All right, ¿qué lo que hay, mi gente? My name is Jose Nunez. I'll be doing my presentation, Bridging Cultures in Healthcare. That is my title of my presentation. The first question I asked in my interview was my healthcare worker. It was very kind of her to take time of her day to be with the interview was, what were some of the cultural aspects in the Hispanic care, patient care? A lot of the things, some of the things that we already mentioned, like natural remedies. A lot of the also one trend that she noticed, and when Hispanic patients would come in, is that a lot of them they would avoid a preventive care. In other words, they would come in. A lot of times they would come in when it was a crisis or the disease got very severe. So a lot of times they come in when it becomes very big, the disease. And also natural remedies was a very big part in the cultural aspect of Hispanic patient care. The second number question was, how was knowing their background important? It was very important, she told me, because to understand their education, their country, their family dynamics it helps a lot how you communicate to the patient. She mentioned with me something I didn't really know or understand. That was that a lot of patients in their other respective countries, a lot of them didn't pass the second grade or the fourth grade or let alone high school. So a lot of them are not there, right, mentally. And so to be able to understand their education, their country, their family dynamics plays a really big role in to be able to understand their background. It's very important. In other words, you wouldn't talk to someone who has a master's degree the same way who hasn't passed the second grade. So it's very, very important to understand the Hispanic patient's background. To know, right, their roots, where they come from, and everything. So to be able to improve the communication with the Hispanic patients, what she would do is a lot simplified explanations. We know that the scientific terminology, everything has a name scientifically. So to be able to simplify those explanations, help them understand, right, in practical ways, include family members for support so they can feel safe and understood and supported, learn about the patient's background, and to be able to simplify those explanations, those big abstract ideas that we see in medical books and everything. One thing that she uses is a teach back technique, was to basically teach them everything, to tell them, and in order for her to ensure that they understood well, is to ask them to explain it back to her so that she can know that they're going home, understanding, to be able to take the necessary steps to proceed with their health. But some of the challenges in the communication she mentioned with me was that a lot of times she noticed a lot of patients have those fixed mindsets. A lot of them could be closed-minded and, based off their culture, their past experiences, they can be able to be more closed-minded and not really accept what the healthcare provider is trying to tell them, right? Being ghosted, just saying no. That was some the things that she challenged in her communication, was in her challenge she faced was things she couldn't control, which is how they would respond, which a lot of times she said it would be, sometimes closed-mindedness. But a lot of times they would come in, right? They come in on some of the things that she noticed, that the reason why they come into the hospital, the clinic, a lot of the health issues, why they're there in the first place, is diabetes, hypertension, high cholesterol. A lot of the diets, Hispanic food, Mexican food, they would eat a lot of carbohydrates that would turn to blood sugar, and tortillas, arroz, habichuela, plátanos, like in Puerto Rico where we're from, potatoes, a lot of carbs that would link to obesity, a lot of Hispanic sweets high in sodium that would make them have high cholesterol and hypertension, high blood pressure, that we know that tastes really good, but in a moderate amount. But that is why a lot of the times they come in. The role of family is very important because the family is everything in Hispanic culture and Hispanic patients. It's their medical support, it's the rock, it's their foundation. It influences their health decisions. Family in Hispanic culture is everything. So the role that family has is very, very important for the Hispanic patients. So with that being said, how can a healthcare worker that's not related to the patient build that trust? How can they make them feel safe. The family member, they know them for a long time, but with the healthcare worker, sometimes they could feel, based off their culture, they can feel uncomfortable. So the methods that she told me to be able to build trust with the patient was having empathy, sympathizing with them, getting where they're at, going in their shoes. Sometimes she would share personal experiences to something similar that the patient is going through. The healthcare worker I interviewed told me that would really help so that the patient, the Hispanic patient, could feel understood, could feel safe, and could feel and know that the healthcare worker wants the best for the Hispanic, for them, right? The patient. So to share those, to be vulnerable, sharing empathy, personal experiences is a very good way in her experience to build trust with those Hispanic patients when there's doubt and uncertainty. Traditional remedies was, I asked her as well, how did she deal with the patients that would only rely more on traditional remedies than the medications that they had to offer? A lot of them, she told me basically respect the traditional remedies. Respect, but if the remedies interfere with the Hispanic with the medication they're trying to give, she would advise them not to. For example, a lot of grapefruit would really sometimes neutralize the medication process that medication does, right? So as long as it doesn't interfere, respect is everything. Respect. To bridge those cultural gaps, we mentioned earlier, use understandable terminology, know the family dynamics, use the teach-back method so that they can understand it, right? Showing empathy to be able to bridge all of those gaps so that the patient could feel insured and safe. The last question I asked the healthcare worker was, what were some of the system improvements that we can do so we can have better help the Hispanic community? She said basically advocate for accessible healthcare. A lot of them are undocumented as well, so they don't have the advantages someone that was born here, who has citizenship here, has. So to be able to lower the cost of insurance, of healthcare, and make it accessible to everybody, we want to see long lines in the pharmacy because we want to ensure that everybody has a chance for better healthcare, because better healthcare is a human right that everyone should have. I learned a lot in this presentation to respect those cultural beliefs. The main thing I learned was to really, as a healthcare provider, to put yourself in the shoes of the patient, to put yourself in their shoes, because a lot of them, they come with uncertainty and doubt, and also to be able to help explain it to them. You're a healthcare provider, you have a very high level of education, and some of them don't have that. So to be able to get in their shoes, have empathy, be sensitive, and really understand where they're at so that you can ensure better health to any patient that comes in. Thank you guys for listening, and have a good one.